It all began in the year of 2020,
when a virus, better known as COVID-19,
changed our lives and devastated our communities.
COVID-19 has impacted our jobs,
our children's ability to go to school,
our ability to socialize and gather with our loved ones,
and prevented us from worshiping at our faith institutions.
And we already knew that healthcare disparities existed.
This pandemic has highlighted just how much of a disparity exists as it relates to people of color.
Did you know that thousands of people die every day of COVID-19?
As people of color, we are more likely to get COVID-19.
More likely to be hospitalized.
And we are most likely to die.
As people of color, we are more likely to work in essential jobs.
And many of us live in multi-generational households, which increases our risk of the virus.
We are dying and burying our loved ones at a much higher rate as compared to other racial and ethnic groups.
We have to make a change.
Although we face such adversity, we are a powerful and resilient community.
The COVID vaccine is now available and is an effective weapon to fight this virus.
This vaccine provides so much hope for the future.
Did you know that a Black scientist was crucial to the development of the vaccine?
As a matter of fact, there were several Black scientists who were on the FDA advisory committee who heavily scrutinized the vaccination before it was widely distributed.
Did you know that thousands of people of color were included in the clinical trials to test the safety and the efficacy of the vaccine?
People that look just like you and me.
Now, I understand that you may be hesitant to get this vaccine, because I was too, until I did more research.
It's so important that you review credible resources
when making a decision about this vaccine.
We understand the healthcare system hasn't always been kind to us.
We remember the Tuskegee experiment.
And we remember Henrietta Lacks.
We know the history of our healthcare system.
But we have made so many advances since then.
And people of color are in key decision-making roles.
As Black physicians, we are our ancestors' wildest dreams.
We went into medicine to advocate for you,
to educate,
to counsel,
to heal.
Please, follow our lead.
When you make the choice to get vaccinated, you are not only protecting yourself from a serious illness,
you are protecting your family,
your friends, your entire community.
And that's why I got vaccinated.
And that's why I got vaccinated.
And that's why I got vaccinated.
And that's why I got vaccinated. And we hope that you will too.
Good afternoon, everyone. Thank you so much for joining us for what promises to be a tremendous hour of great information and inspiration. We are so happy to welcome you to COVID-19 Vaccine Virtual Town Hall. It's all about making it plain and simple and overcoming vaccine hesitancy. On your screen, you're going to see what we're calling a pre-poll. We want to get an idea of what you know about COVID-19 and the vaccine. So if you could kindly go ahead and fill that out, we will go ahead and start our program. I'm Tracy Townsend Enders. I am the president of the Columbus, Ohio chapter of the Links Incorporated. And again, so pleased that you have taken the time on this Sunday afternoon to join us for this informative session. Allow me to welcome a number of very wonderful people who will join us on the program today, starting with our national president of the Links Incorporated, Kimberly Jeffries Leonard, who you will hear from a bit later in the program, and our esteemed Central Area Director, Monica B. Allen. We'd also like to extend a warm welcome to the community here in Central Ohio and those of you who are joining us from other parts of this state and from across the country. Thank you so much. We would also like to say welcome to members of other chapters of the Links Incorporated who are joining us for this important service opportunity. And now it is my pleasure to introduce to some and present to others the Central Area Director of the Links Incorporated, Monica B. Allen, for some opening remarks.
Great. Thank you so much, Madam President. Welcome, ladies, and greetings to the COVID-19 Town Hall, making it plain and simple, overcoming vaccine hesitancy. To you, President Tracy Enders, the fabulous committee that I know has put in countless hours to coordinate this event for today, and all of the members of the Columbus, Ohio chapter, and all of our guests and friends and family. I congratulate you on this event today. I bring you special greetings as the 20th Central Area Director, where 3,800 members in 15 states are serving 70 communities throughout the Midwest. Our work, serving communities of color, continues by educating each person, each family, and each community one by one. I believe I have attended at least 15 of these COVID-19 forums, where many of these concerns are being discussed. And I possibly think, and I sit sometimes and think, how could there possibly be any more to say, any more to think about? But each time I learned something new and realized that the importance of each community's needs to continue to spread the message. The COVID-19 pandemic has brought us to a place where once again, health disparities are amplified, along with other disparities of housing, transportation, education, and so many other economic conditions. Today, we focus on bringing additional spotlight on what needs to happen in our communities to protect us against this deadly pandemic. I commend again the Columbus, Ohio chapter for bringing this topic forward as we seek to overcome access and barriers to the COVID-19 vaccine and completely overcome vaccine hesitancy in our communities of color. I am grateful for your attendance and wish that you might receive a fresh outlook, new ideas, and a steadfast resolve as this journey of educating and supporting our communities continue. Thanks so much for inviting me to join. Have a wonderful afternoon and enjoy the conversation. Thank you.
Thank you so much, Madam Central Area Director. We are certainly glad for your presence, your support, your friendship, and your leadership. Ladies and gentlemen, we do have a full program for you. Again, we'd like to ask you to complete the pre-poll that is on your screen if you haven't done so. We have an esteemed panel for you on this afternoon. It is my honor to introduce those people to you at this time. They include our moderators, Dr. Reversa Joseph, who is a movement disorders neurologist, director of the Movement Disorder Clinic at Chalmers P. Wiley, VA. Dr. Gloria Fleming, professor of clinical ophthalmology, Department of Ophthalmology and Vision Services at The Ohio State University. Allow me to introduce to you our chat moderator, Dr. Shari Hicks Graham, board certified dermatologist, Downtown Dermatology, and founder of LIFSO. Also, a chat moderator on our Facebook platform, Dr. Joshua Joseph, who's an assistant professor of medicine, Division of Endocrinology, Diabetes, and Metabolism at The Ohio State University Wexner Medical Center. And now our esteemed panelists who will share their insight and expertise this morning. Congresswoman Joyce Beatty, representing the 3rd District. Congresswoman Beatty is also the chair of the Congressional Black Caucus. We also have joining with us today, Dr. Mashika Roberts, Health Commissioner, City of Columbus. Dr. Leon McDougall, who is the 121st President of the National Medical Association, Chair, NMA COVID-19 Task Force on Vaccine and Therapeutics. And we have Rochelle Martin, Executive Director, National Alliance on Mental Illness from Franklin County. And now, without further ado, please welcome our moderators, Dr. Fleming and Dr. Joseph.
Thank you, President Tracy. It is an honor to be with you this afternoon, and on behalf of myself and the Columbus, Ohio chapter of the Links Incorporated, I would like to thank you for being with us for this very important discussion. I am so inspired by the work of all of our panelists who are breaking barriers and making life better for all of us. This afternoon, we will address your questions that many of you have sent in prior to the program. I also urge you to post your questions that may arise during the program in the Q&A, and our medical experts will answer your questions in real time. Can you please show the results of the poll? We have an ambitious agenda this afternoon. Thank you. As we will be addressing your questions on topics including updates on COVID-19 virus and mutations, what you need to know and what those mutations mean to you, what are the vaccines, how do they work, how were they developed so quickly, how the vaccines were approved, are they safe, can we as people of color have confidence in the process, and how the vaccines are being disseminated so we can be assured that there's equity and fairness in the distribution process. This will be a fun and rich conversation, full and rich, with vital information we all need. And we know that information is power. So we invite you to sit back and listen closely, and let us begin. Dr. Mashika Roberts, why are we seeing COVID-19 disproportionately affect the Black community? And what are we seeing in Columbus in terms of the rate of infection, hospitalizations, and deaths from COVID-19?
Thank you so much, Dr. Joseph, and I'm glad to be here this afternoon with all of you. The question about disparity is one that for those of us in healthcare is not new, but for many in the community, the COVID-19 pandemic has really put a spotlight on the disparities in our community, not only here in Columbus, but really across the nation. So African Americans have been disproportionately impacted by COVID-19 in terms of infection. And it's not because African Americans are necessarily more vulnerable to the infection, but it's because of the jobs that African Americans hold, their living arrangements that put them at increased risk of exposure to the virus. And then we know many African Americans have chronic health conditions like diabetes, like lung and heart disease. And those diseases put them at increased risk for complications of COVID-19, thus more likely to be hospitalized and potentially even die from COVID-19. I can tell you that when we look at the data here in Franklin County, about 29% of our population is African American here in Franklin County. When we look at our cases, they represent about 22-25% of our cases, that being African Americans. But when we look at our hospitalizations, they're overrepresented, with almost 40% of our hospitalizations we see in African Americans. And then if we look at our deaths here in Franklin County, Black and Brown individuals, so African Americans, Latinos, and Asians are disproportionately represented, and they represent about 60% of our deaths. So we have some issues here. And again, much of it is just because of the jobs they carry. Think about it. Last year, this time when everyone was advised to stay at home, many in the African American community, whether they're in the food service industry like fast food, whether they're in the transit industry, if they're working jobs like housekeeping, whether it's in a hotel or in a hospital, they might not have been equipped with PPE like many of our healthcare workers were. And so they were more likely to be exposed to the infection. And Dr. Joseph, I do apologize. I forgot the second question that you asked me.
No, that was the question.
Okay.
Why are we saying this? And you answered it very thoroughly. Thank you so much, Dr. Roberts. And next, Congresswoman Joyce Beatty, I'd like to bring you into the conversation. Can you tell us what are some of the policies and norms that have led to the Black and Brown communities bearing the disproportionate burden of the COVID-19 infection, hospitalizations, and deaths?
I think, first of all, let me join all of my colleagues and all of my Link sisters and thank the committee and panelists for giving us this opportunity to educate people. I think in addition to what Dr. Roberts said, which is so true, we are disproportionately affected with the coronavirus, and it's a three-headed pandemic. So we know that we are underinsured or no insurance. We also know that when we look at the cases specific to the coronavirus, Black people make up 12 to 13% of the national African American population. Yet when you look at where we are as it relates to this disease, at one time we were contracting it at almost 18% and dying anywhere from 15 to 16%. But part of the problem is if you look at insurance, if you look at education, if you look at housing, if you look at all of the social determinants that put us behind and then being hit with the virus, we had to do double time for it. So when we look federally, some of the things that we're doing obviously is putting more money into individuals' pockets. But the biggest thing that we're looking at to help us is education and awareness. If there is one thing that we can do to help move us, is to educate our communities, because there are so many myths and things that are distorted out there that we're creating policies around putting dollars into programs. For example, we just celebrated last week the 11th anniversary of the Affordable Care Act. So when you look at those states and communities that did not want to expand Medicaid, then the population that needed it the most did not have those dollars to get the services. So we have wrapped $1.9 trillion around programs and policies to make sure that we put dollars in place to help those populations and those individuals who are most in need. It is the most money that we have ever put into our communities, and yet every day it is still a battle for us. So I'm so glad that we have programs like this that can help.
Thank you so much, Congresswoman Beatty. Thank you for your response. I will now turn over to Dr. Fleming.
Good afternoon, all. We're going to pivot right now and take a look at how this COVID-19 pandemic has affected us from an emotional and a mental health perspective. I'd like to bring Director Martin into this conversation at this time. And Director Martin, during 2020, the Ohio Department of Health reported statistics reflecting a surge in opioid abuse and misuse, resulting in a significant increase in rates of addiction and unintentional and intentional deaths. Can you please share a perspective of how you feel the COVID-19 pandemic has influenced this trend?
Yes, thank you, and good afternoon. And I'm honored to be on the be a panelist here. There has been an increase in opioid abuse and overdose, as well as an explosion of identifying mental health issues. NAMI Ohio, our parent company, their help and referral line increased by 500% in calls during April, March, May of last year. Individuals and their families that had no experience or knowledge about mental health exploded during the pandemic. Schools reported a massive increase in kids seeking counseling and help associated with social isolation.
Thank you, Director Martin. Moving along on that note, in this environment of social isolation, anxiety, and fear, what are some of the behavioral and social emotional signs that are evidence that someone may be considering intentional suicide, and what can we do to be more aware of those signs earlier and intervene?
All right, thank you. So the emotional signs are mood swings, aggression, depression, anxiety, isolation, compulsion, inability to concentrate, memory loss, oversensitivity, resentfulness towards others, irritability, behavioral changes are loss of interest, neglecting responsibilities. So what can we do to help in this crisis that we are in? We first have to educate our community, because stigma is one of the biggest hurdles that we have to overcome in our community. And some of the things that are happening within NAMI, Franklin County, and NAMI Ohio, we have partnered with the African American Wellness Agency to train 100 barber and beauticians on mental health first aid. And then we're going to touch over 100,000 individuals that go to barber and beauty shops on teaching them about the signs and symptoms of mental illness and how we can refer them and get them the help that they need. We also are doing things in our churches. We have a faith-based initiative from NAMI Franklin County to help in our churches, to help educate our faith leaders on such things as self-care, because they are identified in our community as being the ones who have to listen to what people are saying. So we have things in place to help our community.
Thank you, Director Martin, and thank you for all of your innovative ways that you are helping us combat these mental health issues. I'm going to turn this over now to Dr. Joseph.
Thank you, Dr. Fleming. Now, as we've discussed how the Black community has been disproportionately affected by COVID-19, let's talk about some solutions and how we can see our way out of this pandemic. Dr. McDougall, I'd like to bring you into the conversation. Can you explain the types of vaccines that are available, how they work, and the most common side effects?
Thank you, Dr. Joseph, for inviting me to participate on this august panel of the Links Incorporated. And so there are two types of vaccines available now, one using messenger RNA or mRNA, and another using the adenovirus platform. To note, both of these types of vaccines have been in development for years. So when we now learn about these vaccines, and they may be new to us because we haven't gone this far into detail concerning vaccine development. And with Operation Warp Speed, some of the red tape was cut that allowed the vaccine development to be moved along at a quicker pace. To note, of the 30,000 or so participants in the Moderna vaccine clinical trial, about 10% of those people were Black, about 3,000 with the Pfizer-BioNTech vaccine, about 10% of the 44,000 or so were Black, about and with the Johnson & Johnson / Janssen vaccine, about 10% of those participants were Black. And so we are well represented in the clinical trial, so that gives us good confidence in the findings. And with our task force, we met with the scientists from Pfizer, Moderna, Johnson & Johnson / Janssen, and AstraZeneca to ask about were there any differences, serious adverse event differences when comparing the cohort of Black participants compared to others, and that was not seen. So we have confidence in the vaccines.
Thank you. So you're explaining how we can have confidence because there were Black people represented in the clinical trials. And can you go in just a layman's term explaining to us how the vaccines work and what the most common side effects someone could expect if they receive the vaccine?
So yes, so the vaccines enable our body to marshal our defense network. It allows our body to present antibodies, to develop antibodies. So when we are exposed to the live coronavirus, we're able to fend that infection off. And to note, for all the people who have been immunized by the vaccines, there have been no deaths or hospitalizations among that group of people who were vaccinated. So I also want to bring that to attention, because sometimes you hear all this news, well, this vaccine 79%, this vaccine 94%. So the percent I want to focus on and bring to the audience attention is 0 deaths and 0 hospitalizations. So that's the percent I would really want to have attention drawn to.
Okay, thank you for that, because that is a question that we have received, is like how the different percentages of the effectiveness of the vaccines and which one they should receive. So you're saying that all had basically all the vaccines prevented from death. So that's the main percentage that we should all be concerned about. Is that correct?
Yes.
Okay, thank you. And just one last closing question in regards to the vaccines. So I'm understanding that with the mRNA, the two that are out, you would be getting 2 injections. Is that correct? And then with the J&J, we're expecting that there's just 1 injection. Can you explain that?
Yes. So the dose intervals and the number of doses are based on the immunogenicity. So with the Pfizer and Moderna messenger RNA vaccines, the clinical trials involve 2 shots to allow the body to produce antibodies sufficient enough to ward off infections. So for the J&J/Janssen vaccine, there is a 1-dose vaccine. You are correct. And usually around 7 to 14 days after receiving the vaccine, one becomes or has reached their optimal immunity.
Okay, thank you. And one last question, Dr. McDougall. The NMA COVID task force that you had mentioned proposed questions to the clinical scientist teams regarding vaccine safety and administration in special population groups that are disproportionately affected in the communities of colors, those with sickle cell disease, HIV, AIDS, and autoimmune conditions. Can you share why individuals in these groups can feel confident about moving forward with the vaccine?
Yes, another good question. So, for example, with HIV, there was a population enrolled with controlled HIV whereby their CD4 count was greater than 200 and there was an undetectable viral load. And those specific results will be reported out during the biologics license application. At this point, they haven't detected any differences, adverse differences compared to others. And in general, with stable, controlled chronic ailments, one is thought to qualify for the vaccines. With that being said, we're saying it's advisable to consult with one's physician. And in regards to sickle cell, the Moderna trial, I think they had 6 patients in the control, 6 patients in the participant group. Those reports haven't been released yet. And I think, again, with the biologics license application, also with the Pfizer vaccine, with the J&J vaccine, they did not report collecting data on persons with sickle cell.
Okay, thank you for that, Dr. McDougall. Now we'll turn it over to Dr. Fleming.
Thank you. Congresswoman Beatty, we're going to specifically talk a little bit about the vaccine rollout. With this rollout, we have definitely celebrated some successes, especially recently as we have observed the increase in the trajectory of getting the vaccine out into our community. However, there's still some challenges in achieving equity and parity, as evidenced as we see in the disparities across races in our community in getting these vaccinations. Can you comment on what the federal response or legislative initiatives may be to ensure fairness and equity, not only in the distribution, but also in the access, especially to our marginalized populations?
Thank you so much for that question, Dr. Flemings. I can tell you just this week, the President of the United States, at the request of the Congressional Black Caucus, we got very specific. For example, just like Dr. McDougall talked about sickle cell, we asked to use clinics that treated those individuals who were on dialysis or those individuals who were diabetic. We asked him to put dollars into community health centers because part of the issue is, as we know, many individuals in our urban communities, predominantly Black communities, don't have transportation to get someplace. We still have to make sure on the hesitancy, and I'm glad we're using that word today because we need to dispel that, because then our vaccines will go to other people who aren't as hesitant. So one of the things we've done is the Congressional Black Caucus and other members of the cabinet, including the vice president, we did very much like the video we showed at the beginning, and it will be coming out this week, with the members of the Congressional Black Caucus rolling up their sleeves, but actually telling people, we want you to get the vaccine. We're really overstepping. We're showing them that we're doing it. In our community here, our African American paper that's coming out on April the 1st will have an ad saying that we should get it. Dollars are being put into churches, to Black media. Some $20 billion was just put in what we're calling get a shot in the arm. We also put dollars in to speed up the research. But one of the things is, and everyone has said it, and we can't say it enough, we can write all the policies, put all the dollars in as we've done. When you think about the 1.9 trillion, much of it went to a shot in the arm. Other dollars went because of the effect of COVID, but we've also opened it up, and Dr. Roberts has done an amazing job here. But here's the one thing we have decided that we must do, and it's more programmatic than policy, and that is let people see us. And I'm glad we talked about the clinical trials, because Dr. Kizzy Corbett, who was affiliated with the mRNA, young Black scientist. And one of the things she said to us, we need to all put our faces on it. We need to go into the communities, and dollars have been allotted for us to do that. So we're giving directives to government. We put money into state and local government, so they could then have funds to make sure that it gets out appropriately. Now, the last thing with that is we need more Dr. Roberts. We need more people who early on in our communities got out front with governors and said, we have to do this. So that's where the Congressional Black Caucus is being a backstop. Across the country, members are doing what we're doing today. And we're going to continue to do it next week. We're going to learn from you all and the questions and the survey that you did. We're posting it on our website so people can get educated. And thank you for that question.
Excellent. Thank you so much for your response. It's very insightful. As a follow-up question, about 30 to 35% of COVID-19 illnesses and deaths among the Black and Brown community are under the age of 65, which is very different than our majority counterparts, where they're more affected above the age of 65. How will we address this generational consequences that will inevitably arise from the loss of productivity of these individuals who would have otherwise been at the height of their productivity in life? Congresswoman Beatty.
Oh, I'm sorry. Thank you. I'm sorry. I think one of the things that we have to do is it is intergenerational. We can't focus on just one group. We have to focus on those who are in that younger group. And one of the things I failed to mention, right here in the 3rd Congressional District, we put $441 million in just for COVID-19 relief funds. And direct going into the city is $185 million programmatic dollars, vaccine dollars. And again, I think the answer is making people aware of the effects and how disproportionately we are affected with it. You can't change people unless you educate them. You can't change people unless you change the environment that they're in and help them understand how this is affecting us. I never talk about COVID-19 in healthcare only or in isolation, because it's a three-headed pandemic. And that's where, when you talk about the intersectionality of the younger generation and then folks more in my generation or those who are seniors, it is the healthcare, but it is also the economics of it. And that plays a huge factor in how we move the needle. And then it's all the social injustices that we're dealing with. If you have people who are living in poverty or living on the street, we put $5 billion in for those who are homeless, because we tend to think of us, and we talk about people, whether they are in the younger generation or they're in the more mature generation. We have to think about those who are the least of us, the folks who can't get on a Zoom, the folks who don't understand how to do what we're doing. So I think we have to start at a very elementary level, and I think we have to educate our children. I am so glad that we're opening up the vaccine to those who are 16 and to young folks, so they're engaged in talking about it. That's the only way we're going to come together and move, by educating and getting people engaged at both levels.
Thank you, Congresswoman Beatty, very much. I'm going to turn this back to Dr. Joseph.
Thank you, Dr. Fleming. So we've heard a lot of myths out there about COVID-19 vaccine, and I'd like to have an opportunity for our medical experts to debunk some of these myths. Dr. Roberts, I'd like to bring you into the conversation. Does the vaccine contain a microchip or a tracking device?
Well, thanks for that question. Yes, you're right. There are a lot of myths. And no, the vaccine does not contain any tracking devices. The vaccine, as Dr. McDougall said, was made, or two of the vaccines were made on a messenger RNA platform. But I will assure you that vaccine does not alter your DNA. Your DNA is there to stay. No drug, no vaccine can change or manipulate your DNA.
Thank you, Dr. Roberts. Dr. McDougall, what is your response to this statement? And I know that you kind of touched upon this, but this we're getting a lot. I don't want to get the vaccine because it wasn't tested enough on Black people.
Another good question, and that's where having conversations as we are this afternoon and sharing what's true. 3,000 people were involved with the Moderna trial and 4,400 people with the Pfizer trial, and 10% of those with the Johnson & Johnson/Janssen trial. So we are represented, and we do have confidence in the findings. So another good question.
Thank you, Dr. McDougall. Dr. Roberts, what is your response to this statement? The coronavirus is being injected into me through this vaccine, and I could get COVID-19 by being vaccinated.
Yeah, another myth we've heard a lot about. So this vaccine is not a live vaccine, meaning there is no live virus in the vaccine. So it will not give you COVID-19. It'll give you the proper defense mechanism so you can fight against COVID-19 if it were to enter your body in the future. But it will not cause you to test positive for COVID-19. You could have what many like to call side effects, which we really like to call reactogenicity from the vaccine, where you'll have a headache, maybe some fever, maybe some body aches and fatigue. But I assure you, it is not COVID-19. And anyone who's had COVID-19, they will tell you that the symptoms that you experience after the vaccine pale in comparison to having the actual disease or the actual infection.
Now, Dr. Roberts, you said reactogenicity. So I know we're speaking to a broad audience here. So essentially, is your body responding to the vaccine, and you're making antibodies and and such? So that's a term for 2020, reactogenicity.
Good point,
Yes.
Dr. McDougall. But I just like to make sure people understand, when you think of side effects, you often think of the negative connotation. And so the symptoms you experience after this vaccine, and any vaccine really, is what we in the medical field anticipate and expect. And then there are adverse events, is which we don't anticipate and which we don't expect.
Thank you very much for that clarification. Thank you both. And Dr. McDougall, I'd like for you to answer the question. We're getting this myth, or we're hearing this, that the vaccine may cause me to be sterile. So I don't want to get the vaccine. How do you respond to that?
So that's another good question, and it's a common question. So there have been reproductive biology studies done on the vaccines. There is no evidence supporting effects on reproduction or fertility. So that's a good, very good. Thank you for asking that.
Okay, thank you very much. Thank you both.
And Dr. Can I say something on that? Because we hear that the most for people who are in an older generation, because they refer back to the Tuskegee experiment. And so many people believe that today with this. And that was one of the early on things, even folks like us. And I was guilty of saying there was some fear because we didn't have medicine, science, and technology when we first got into this almost 2 years ago. We were hearing it wasn't real, it was a hoax, it was from China only. And now that we have science, medicine, and technology on our side, I think that's something that we need to talk about a lot, because that myth came from people who were intellectual. I heard it from people in the healthcare field. What about the Tuskegee experiment or Henrietta Lacks? So I am really glad, Dr. Joseph, that we asked that and that the doctors are answering that.
Thank you. Thank you so much, Congresswoman Beatty. And lastly, Dr. Mashika, can you respond to this statement that the vaccine steps in the vaccine process were skipped? The FDA just approved it at warp speed. Can you help us respond to that?
Sure, happy to. So I think the name Operation Warp Speed has really given a negative connotation to many across the nation, but specifically in the African American community. They obviously associate it with our last administration, which many people have their own strong opinions of. I can assure you that no shortcuts were taken to get to the point where we are now, where we have 3 vaccines that received emergency use authorization. As Dr. McDougall shared early on, the messenger RNA platform, as well as the adenovirus platform, were platforms for vaccines that we in the science field had some familiarity with. This was not brand new as of December of 2019. These had been looked at in the lab, they'd been practiced, they'd been studied for years. I should also tell people that coronavirus, which is the virus that causes COVID-19, is a well-known virus in the scientific field. We've had the MERS outbreak, we've had SARS, and we've had other diseases that have been caused by coronavirus. So this particular kind of coronavirus was new, but the virus itself was not new. So with all of that information that scientists had for years, when they actually got the fingerprint of COVID-19 in January of 2020, they were able to quickly go to work and put together a vaccine that would be safe and effective. And scientists from around the world worked together on this. They knew that a safe and effective vaccine was the only way to get to the other side of this pandemic. They did things parallel. Usually we have clinical trials and we have 4 phases. And usually once phase 1 is done, then you move on to phase 2 and then phase 3. Well, because of this pandemic, they did the phases concurrently. That saved a lot of time. So they saved time by already knowing something about this virus, already having platforms for the vaccine that they could use, doing the clinical trials concurrently instead of back to back. And then, we can't deny they got some financial support from the federal government here, as well as governments from around the country, that allowed them to quickly enroll the numbers that Dr. McDougall talked about. 40,000 plus, and each of these companies were enrolled in these clinical trials. So that gave them good numbers and good data that they could bring to the FDA and get that emergency use authorization. So the only shortcut that was made, if any shortcut was made, was the FDA allowed these vaccines to go to the front of the line. And so they surpassed some drugs that have been waiting for years to get in front of the FDA. The FDA said, no, this is more important. We're going to take you first, and we're going to deal with those other drugs later.
Thank you for your response. So basically, no steps were skipped in the process.
No steps were skipped.
Thank you. We'll move on to Dr. Fleming. Thank you.
Congresswoman Beatty, you mentioned earlier that you can't change people unless you educate them. So I think we would all agree that education is our grounding core value that we all need to ascend professionally and attain economic stability. So let's readdress this back to education. Education parity and inequities have affected communities of color pre-COVID. Now, a year and a half later, after remote learning, virtual training, communities of color that were fraught with difficulties with Wi-Fi, with inadequate broadband, with challenges with homeschooling their children, we now face an even wider educational gap. Can you share with us what some of the legislative initiatives or mandates will be to help diminish this gap, even if we are able to vaccinate ourselves out of this pandemic?
This is a very difficult one, Dr. Fleming. So what I can tell you is $130 billion from the federal government to return students and teachers safely to school. $419 million came right here to the Columbus Public Schools alone. We also are looking at making sure that we keep schools open to improve educational standards, because here's what we know. When children in urban, inner city, and rural schools got hit with the pandemic, many of our children were already behind. So one of the things that has happened across the country is we've been relaxed on some of the tests that you have to take to graduate to continue. Well, that's half full, half empty, because many of our children will be able to go on because they didn't have that test. But we know if children are not in school, every single child doesn't have access to the same thing at home. We can put all the laptops in homes, but if you don't have someone to tell you how to get on a virtual Zoom or StreamYard or Cisco, then having that's not good. We are having legislation with broadband, so I'm glad you mentioned that. We have many individuals where even if they had the laptop or the computer, they don't have access to the broadband to be able to get on it, and that's rural and urban communities. We've heard all of the stories of children going and sitting outside of restaurants and cafes so they could get hooked on. It hit us right here in our community with the YWCA Family Center. When we didn't have, children weren't able to go to school, weren't able to leave, they didn't have the computers, they didn't have the capacity for the broadband. And so we had to put all of those things in there. So again, we all have to do a little more. We have to read to children. We have to have programs where we go into the schools. We have to have after school programs where we all roll up our sleeves and do a little more, because some schools are not back in yet. Although we're getting vaccinated, we know that many of the teachers were not in that first round, although they were essential workers. Every state did not have the same capacity because every governor didn't have a minority task force, or every state didn't have linked chapters and people like Dr. McDougall and all of you on here. Having all of the physicians on here who look like those children, it makes a difference. And that's why we do what we do. So thank you. And it's not a complete answer. And I'm going to say it's not a complete answer because I want everyone out here watching to think of something they can do for a child. We know the children in the neighborhood. We know the mothers and the fathers who are single parents or grandparents who are rearing children and they don't have the capacity. So it takes a village and we have to be part of that village.
Yes, thank you. I know that was a very complicated question and thank you for addressing it so poignantly. Dr. McDougall, a question from one of our participants. Is the COVID-19 vaccine similar to the flu vaccine? And if so, or if not, how long will it last? And is there a need for a booster?
So another good question. from what we know so far, we're thinking that immunity will last at least about 6 months, but that's an ongoing process as we follow outcomes of people who have received the vaccine. As you may know, with the vaccines, the companies have agreed to a 2-year follow-up period to monitor for continued effectiveness and serious adverse events. So that is a possibility. I don't think we know right now what that interval would be. That being said, with the outcomes thus far, we're having good outcomes in regards to no hospitalizations and no deaths.
Thank you. Dr. Joseph.
Thank you. Dr. McDougall, another follow-up question to that. What are, if any, are we seeing any potential long-term side effects of the COVID vaccine? And what are the consequences of not getting the vaccine?
So in regards to long-term side effects, we haven't seen that. I know from a standpoint of side effects, or I'll just say serious adverse events, some people have had serious allergic response to the vaccine, and that has occurred mostly in people who had known serious allergies. In regards to, and what was the second part of that again?
What would be the consequences of not getting the vaccine?
So I think the consequences would be increased risk, right? I'm a family physician. I practice on the Near East Side of Columbus, Ohio. I've had patients who have gone on to be hospitalized, placed on a ventilator, and I'm thinking of one person in particular in his mid-30s, hospitalized for about 6 weeks, several of those in the ICU on a ventilator, and subsequently being discharged on dialysis. So I think we tend to just hear the statistics about death, which is the ultimate consequence, and whether one is able to survive. And there's a lot in between that makes it really important for us to get vaccinated.
Thank you, Dr. McDougall.
And I would just add, Dr. Joseph, again, with all three of the vaccines we have, they're 100% effective at reducing hospitalization and death. And that's ultimately what we want to see. And so the consequences of not getting the vaccine is what Dr. McDougall said. You're going to have more individuals who could get sick and be hospitalized and then have some long-term health conditions as a result of that infection. And the fewer people who get vaccinated, the longer it's going to take for us to get to the other side of this pandemic, which I know we all want to return to some sense of normalcy sooner rather than later.
Thank you, Dr. Roberts. And a line of that question I have for you. What are the CDC guidelines for vaccinated individuals? And specifically, when can we get back to normal? And why do we still need to wear a mask in public if we've been vaccinated?
All great questions. First, I would just say, I think we all have to take a pause and think about what the new normal is going to be. I don't know when we're going to get back to life here in the United States in January of 2020. It might take us for some time to have football stadiums at full capacity, to have hotels and restaurants at full capacity, to not wear a mask anywhere. That might take us some time. It should be a gradual approach before we get back to that life pre-COVID. And then even then, there are going to be some things that are going to be very different in our lives as a result of this pandemic that we need to accept. I can't tell you what those are going to be. I think we're all going to be much more mindful of our health and our symptoms and avoid situations where we might think, I don't feel right. I might just want to stay home to figure this out. But in terms of the CDC guidance for those who have been vaccinated, CDC has said now that if you've been vaccinated, you should still wear a mask while out in public. The reason for that is because you can get COVID-19. As we said, they're 100% effective at reducing hospitalizations and death, but they're not 100% effective at reducing infection. And so you can have the infection even though you've been vaccinated and have no symptoms at all or mild symptoms, and you could potentially shed that virus to someone who is not vaccinated or not fully vaccinated. And so it is important when you're out in public that you continue to wear masks. Now, the CDC has said when you're around other people who you know have been vaccinated, fully vaccinated, again, fully vaccinated is at least 2 weeks out from the last vaccine they need in the series. So if they got Moderna or Pfizer, it's 2 weeks out from that second dose. If they got Johnson & Johnson, it's 2 weeks out from that first and only dose. So if you're around other people who've been fully vaccinated, you can take your mask off as long as you're in a controlled environment and everyone there has been fully vaccinated. Now, we know children are not eligible for vaccines quite yet, only those who are 16 and older. So grandparents can be around their grandchildren if the grandparents are fully vaccinated, even though the kids might not be vaccinated. The CDC has said that can happen again in controlled environments. But we're going to be wearing our masks for a while until we get more people in our community vaccinated. Right now, here in the state of Ohio, we've only got about a quarter of our residents vaccinated, which is about the same here for Franklin County. So we've got a ways to go before we can comfortably take off our masks.
Thank you, Dr. Roberts. And Dr. McDougall, this is another question that we've received. What will happen with the variances and the new mutations of the virus? Can the vaccination still help us?
Yes, the vaccinations can still help us to give us some level of immunity. And when we are able to immunize a greater percentage of the population, it will even make it less likely that these various variants will continue to grow in numbers. So I know the government, Dr. Roberts, the state, Congresswoman Beatty, we're all working together to allow for accessibility of the vaccines so we can, as soon as possible, get everyone vaccinated.
Thank you, Dr. McDougall. Dr. Fleming?
Yes, thank you. Director Martin, can you give us some suggestions if a person themselves or one of their loved ones are aware that they are now beginning to increase use of alcohol and other substances in response to their anxiety during this pandemic?
Sure. So the Adam Board of Franklin County provides services, addiction services and mental health treatment services. There are 34 providers in our county that can help address those issues. And you can contact the Adam Board of Franklin County, or you can contact NAMI Franklin County. And I, all the time, every day, refer families or someone who is living with a mental illness for care. And we have the ability to do that. You can also call a crisis line and talk to someone on the crisis line. You can contact NAMI Ohio. They have a crisis line if you feel that you need to do that. But we are available to reach people to help them get the services that they need for their care.
Thank you so much. Dr. Roberts, rapid fire, two quick questions. So the state of Ohio has expanded eligibility to 16 and up. Teenagers, this is the last thing that they're thinking about. What advice can you give to families to encourage their teenagers to go get vaccinated?
Well, one of the big advantages of getting vaccinated, other than the fact that you're not going to be hospitalized or die from COVID-19, is the CDC has relaxed some of their requirements for quarantine if you're exposed to someone with COVID-19. We know here, when we look at our school-age kids, many of them have been quarantined because they're exposed to someone at school, after school, or in a sports activity with COVID-19. So by being vaccinated, they would no longer have to go through that quarantine process. They could continue all their social activities. So I really encourage parents and teens to think about this, talk to your healthcare provider about it. And I'm really excited that we have a partnership coming out soon where our Nationwide Children's Hospital is going to be working with our school districts and going into the schools and providing vaccines for our kids at the school-based setting.
Thank you so much. We're going to turn this over now.
Thank you. So as we have discussed the effects of COVID-19 in the Black community, the mental health aspects of COVID-19, the vaccines rolled out, and dispelled myths, we just wanted to get a final response from each of the panelists about how we can overcome vaccine hesitancy in the Black community. Congresswoman Beatty.
I think the first thing we can do is lead by example. I think we can share this video tonight. I love the video with the Black doctors. We're going to send you the video with the members of Congress who are representative of individuals across the country. We represent 17 million Black Americans and 82 million Americans. Lead by example, talk about it. Tell people you got vaccinated. And I like what Dr. Roberts said, you know, other than you can die if you don't get it. And I think the biggest thing is telling people we will be back to whatever our new normal is. And I think people are ready for that.
Thank you, Congresswoman Beatty. Rochelle Martin.
She is muted.
Okay, Rochelle Martin, can you unmute yourself?
I'm sorry. So I agree with Congresswoman Beatty, and by letting people know that you have been vaccinated and to take care of your mental health as you go through this journey of this pandemic is very important as well.
Thank you, Rochelle Martin. Dr. McDougall?
So I would just encourage Links Incorporated and other professional organizations and community-based organizations to continue that outreach. And the important part of this is the conversation. So I would ask people to ask questions. If you have questions, we can help answer them so they can reach a level of comfort and increase confidence in receiving the vaccine.
Thank you, Dr. McDougall. Dr. Roberts?
Yeah, I would just say, kind of echo what everyone else has said. If you have questions, get your questions answered by a reliable source. Go to a reliable webpage, go to friends who have a medical background and get your questions answered. And if you do decide you want the vaccine, which I hope many of you do, and you live here in Ohio, Columbus Public Health is happy to vaccinate you, and you can call 614-645-1519.
Thank you, Dr. Roberts. We have been so honored to take part of this panel of extraordinary leaders in our community. They should all be celebrated for their achievements, supported and held closely in our hearts for the incredible challenges that they are facing right now during these turbulent times. We hope that you have learned a lot during our time together this afternoon, and that this discussion will help you to be able to make the most informed decision for yourself and your family. And now we will have some remarks from the president of the Columbus, Ohio chapter of the Links Incorporated, Tracy Townsend Enders. Thank you.
Thank you, Dr. Joseph, and thank you, Dr. Fleming, for serving as our moderators this afternoon. And to our panel, this has been enlightening. It has been highly informative, and we really appreciate how you have touched on the physical, the medical, and you have also talked about the mental health that our families, our children are facing as we are in this pandemic. We thank you so much for embracing science and sharing your tremendous wealth of knowledge with our participants. And of course, we know with Congresswoman Beatty on the panel, it reiterates that voting matters. And so that we always want to exercise that right that we have. That's all so much of what we've learned in the year of this pandemic. It is now my esteemed pleasure to bring to you the National President of the Links Incorporated, Kimberly Jeffries Leonard, who has led our organization in embracing science and serving our community and operating on the pillars of our organization of friendship and service. President Kimberly Jeffries Leonard.
Thank you so much, Madam President Tracy. I'm just so pleased to be here this afternoon at this esteemed program. So plain and simple, if knowledge is power, then this afternoon we are all better equipped for this war on our health and our lives, because this has truly been an empowering event. I want to thank our participants, our panelists, and our audience for taking the time to get the latest information on how we can beat COVID. I know you all have heard them, but I just want to name them. For our participants, of course, Madam President Tracy Townsend Enders, who is the president of the Columbus, Ohio chapter of the Links Incorporated, our Central Area Director, Monica Boone Allen, our moderators, Reversa Joseph, MD, who is the co-chair of the HHS facet of the chapter, and Gloria Fleming, MD, who is also the co-chair of the Columbus, Ohio HHS facet, our chat moderator, Sherry Hicks Graham, and our panelists, the truly amazing Link Joyce Beatty, our U.S. representative for Ohio's 3rd Congressional District and the chair of the Congressional Black Caucus, and a member of the Columbus, Ohio chapter, and a member of my legislative committee. So thank you to Dr. Leon McDougall. I certainly have to mention his name, who is the national president of the National Medical Association and a national partner of the Links Incorporated. Link Mashika Roberts, MD, who is the health commissioner. Yes, she is a link of the Columbus Public Health and is a member of the Columbus, Ohio chapter of the Links Incorporated. Rochelle Martin, the executive director of the National Alliance on Mental Illness of Franklin County. And I really do want to thank the Columbus, Ohio chapter, again, under the dynamic leadership of Tracy Enders, for bringing this forum to our communities in Columbus and beyond. Of course, this is the chapter of our National Director of Legislative Issues and Public Affairs, Karen Jefferson Morrison. So we know this chapter is on top of this issue. COVID-19 has proved to be a formidable enemy. No one has not been untouched by COVID-19. And we are still losing more than 1,000 lives every day in this country and nearly 9,000 worldwide. However, as you heard today, we do have weapons in this war. And the information that you heard reinforced what either we knew or brought information to us that we did not know. Wearing masks, washing our hands, maintaining social distancing, avoiding large groups are not just suggestions. These are required practices for our health sake. And additionally, our best defense is the vaccine. As you heard this afternoon, we have to be ruled by science in the process and not emotions in politics. We, as people of African descent, have been most negatively impacted and affected by this pandemic. So you know, and you've heard from this panel, that we cannot afford to sit on the sidelines. Hesitation can mean death. So unless it's been determined by your doctor that it's unsafe for you to get the vaccine, please get vaccinated as soon as you do so. Doesn't matter which one, just put your arm out there and take that vaccine. I want you to encourage your family members, your neighbors, and your friends to do the same. We know that vaccinations are the best way to work against severe illness, hospitalization, and death. Many of you, like I have lost a family member to COVID. Do not play. I want to thank you again to the Columbus chapter for bringing this informative panel to us. And I want to thank the participants for spending this time with the Columbus chapter this afternoon. Please be an ambassador for safety protocols and vaccinations. Making it plain and simple is not just idle chat. It can save our lives. Thank you so much for allowing me the opportunity to join you.
Thank you so much, Madam President. We appreciate your presence, and for you simply making it plain and simple. We do appreciate you. And now, ladies and gentlemen, I want to again thank our panelists, and I'd also like to extend a special thank you and note of appreciation to Columbus, Ohio chapter member Courtney Noble Hale for her expertise in working with our company, Speaker Easy, who is responsible for today's production. We wish you great health and say to you, be safe. Thank you so much for joining us. Have a great evening. Thank you so much, Madam President. Thank you.
Thank you all. Phenomenal what I heard. The questions and answers were excellent and the moderation was phenomenal.